all good. So thank you. Welcome everyone to the CHEP seminar for the first 3 weeks of the semester. We shall be virtual before hopefully we can get going with in-person talks. I guess we'll hear from the university on the rules for that soon enough. This week we're lucky to have Don Kenkel joining us. Don is the Andrew Dickson White Professor of Public Policy and Economics at the new Brooks School of Public Policy at Cornell University. He's also a research associate at the National Bureau of Economic Research, and he previously served as a chief economist at the White House Council of Economic Advisors. His research expertise is on the economics of disease prevention and health promotion, with particular attention to tobacco use. He's the author of a chapter on prevention in the Handbook of Health Economics, and is published in leading journals in the field multiple times in the Journal of Political Economy, Journal of Applied Econometrics, the Review of Economics and Statistics, and of course the Journal of Health Economics. And we're fortunate to have him here to talk to us about vaping and smoking and information shocks. And just a personal word, I mean, Don was an incredibly inspiring mentor to me. Going back to the days when I took courses with him when I was an undergraduate student at Cornell. I took a cost-benefit analysis class back in 1996, and it was fantastic. So I feel very lucky and fortunate to have Don here to join us this week. Don, welcome.
Well, thank you very much, and thank you for a very kind introduction. And to return the compliments, Joe, you look just like you did in 1996. How do you do it?
Fabulous, thank you.
So let me try to share my screen here. Hopefully that'll work. Okay, so everybody seeing my shared screen? Okay, great. Okay, yeah, so this is work I'll mention all my co-authors right in a second, but I'll mention that this is Alan Matthews helped come up with this the imagery in this title, that what we talked about information shock, and he decided we should say something about sparking. So we have a shock that does an information shock spark changes in vaping and smoking. And as I said, this is a product of a big team of researchers that is working on a series of projects, about tobacco harm reduction, I guess I should say, smoking, but also the new products like vaping and heated tobacco products. And so this is the long list of the team. It has several faculty members: Alan Matthews, Mike Lovenheim, who's now the chair of the Department of Economics, but was also a longtime colleague in what was PAM, is now the Brooks School, Lawrence Jin and Jason Somerville, who are both former Cornell PhD students, Hua Wang, who is been a longtime research associate working with us at Cornell, and then a number of current PhD students at Cornell: Grace, Ravathi, David, and Sen. So it's a big team. They're working on a kind of an interconnected set of projects, many of which I might have a chance to at least mention briefly today, and they contributed in varying degrees to the paper today. Should also go through disclosures. Because of Jason, we have to say that the Federal Reserve System has nothing to do with this research. Because we're using data from Nielsen, we have to say that Nielsen has nothing to do with this research. And probably the more important one is that we are funded by a grant to Cornell, through Office of Sponsored Programs and everything, from the Foundation for a Smoke-Free World. And the FSFW is a nonprofit 501c3 private foundation. And if this is working just like any other grant, where what we're doing is entirely independent. They have no role in the design of the research, decisions to submit the manuscripts for publication or anything else. I mention all this slightly, to be very clearly disclosing, because FSFW is funded mainly from gifts from PMI, which manufactures, Philip Morris International, which manufactures cigarettes and other tobacco products. And FSFW's bylaws make them independent from Philip Morris. And as I said, we're independent from FSFW. Nevertheless, in some circles of public health, people are quite concerned about sort of any kind of tobacco industry funding. And I just wanted to sort of, again, disclose this indirect link, but also just restate that this research is no way connected with either the FSFW and certainly in no way with PMI. Research on vaping has actually gotten controversial enough that some people in the field suggest that it's a good idea to sort of disclose upfront sort of where you stand in the debate. I think my first couple of slides will make that very clear, that I think that e-cigarettes and vaping have substantial potential for improving public health. But I feel like that's a fact, or evidence-based conclusion, not a public opinion, not a private opinion. But I will just go ahead and disclose that up front too. That, you wonder where I am. As I said, I don't think you're going to be, you'd wonder long because of this next slide. I thought it'd be useful, even before I start introducing my own research, to just sort of get some background facts. I mean, especially for a group of people who don't necessarily have worked on tobacco or and more recently e-cigarette policies. That there's a long time saying in tobacco research that people smoke for the nicotine but die from the tar. And so nicotine is the addictive substance that's in tobacco. Tar is everything else that's created by setting the tobacco on fire and inhaling the smoke into your lungs. And so that's the key difference, combustion. So the National Academy of Sciences a couple years ago, states there's conclusive evidence that completely substituting e-cigarettes for combustible tobacco cigarettes reduces users' exposures to numerous toxicants and carcinogens present in combustible tobacco cigarettes. And there's very bench science kind of research that compares the levels of these things in the combusted smoke versus the vapor that comes out of e-cigarettes. And it's orders of magnitude smaller in the e-cigarettes. There's also a growing body of evidence from randomized controlled trials that e-cigarettes really help smokers quit. This important one published in the New England Journal of Medicine a couple of years ago found that e-cigarettes were twice as effective for smoking cessation than nicotine patch. The Cochrane review reviews public health research in a long, does lots of meta-analysis and things, and they have a more comprehensive set. And the twice as effective, not all the studies find that they're twice as effective, but there's lots of evidence that e-cigarettes are very effective in helping smokers quit. And that evidence is finally starting to change US policy. Again, I don't know how much people may have, aware or not aware of this, but actually starting back in 2009, there was the Tobacco Control Act, which was passed and signed by President Obama, that gave the FDA regulatory authority over the tobacco industry. So there's now a Center for Tobacco Products of the FDA. Now, it took them a while to decide that they should also be regulating e-cigarettes, but starting in 2016, they started moving down the path to regulate e-cigarettes and other non-combusted tobacco products. And they've got this one pathway for authorizing products, which is called the Modified Risk Tobacco Product Pathway. And they've approved, or they've authorized. The FDA doesn't like to say they approve any tobacco product, but they do authorize products to be on the market. They've authorized 2 non-combusted products through this modified risk tobacco product: Swedish Match snus, which is a form of smokeless tobacco. They've authorized that they can make claims that they're a reduced risk product. And the IQOS product, which is a heated tobacco product, it's a little bit different than than an e-cigarette. It's when the tobacco is actually heated up, and it's never catches on fire, never combusted. The IQOS can authorize to market itself as a reduced exposure product. They didn't convince the FDA that it was actually reduced risk, but they did provide enough evidence that it exposed its users to much, again, fewer toxicants, like that quote from the National Academy of Sciences. And then most recently, just earlier in September 2021, the FDA authorized Vuse, is a brand name of e-cigarettes. And they authorized a couple of different types of tobacco flavored e-cigarettes to be marketed as appropriate. And that approval meant that the FDA says this is appropriate for public health. And when you read the approval statements from the FDA, they say that's because of the health benefits if adult smokers switch to e-cigarettes. So just making the case here that there's a lot of evidence out there that e-cigarettes have this potential to reduce the harm from smoking.
Don, just a quick, just a quick
Yeah.
question. Are there any, I mean, I know some of these products are very new relative to data certainly being released on them, these electronic nicotine delivery systems products, but are there any different types of sort of, ENDS products that appear to be more effective than others in inducing cessation, or it's still too early to say?
No, some of the evidence it's probably coming out. I'm not sure how many of these next comments I'll make. I could definitely point to an RCT right away, but I think either from RCTs or from sort of people on the ground that use these things in treatments, and they're being used a lot for treatment for smoking cessation in Great Britain. Great Britain has really advocated the use of e-cigarettes, and one of the things they're finding, I think there's evidence there that the e-cigarettes that deliver higher nicotine levels are more effective in smoking cessation. There's also some evidence, and maybe partly counterintuitive, that flavored e-cigarettes might be better for smoking cessation. And I mentioned this to a few people in our chats today earlier. I think my understanding of it is partly that it helps smokers, really break the connection between their old habit and their new way of getting nicotine. And so if you're now getting your nicotine through this thing that tastes like mint, or even something better than that, mango flavored or something that you really enjoy, that makes going back to the Marlboros kind of distasteful. Now, that evidence was sort of explicitly rejected by the FDA. The FDA so far has issued marketing denial orders for a whole bunch of e-cigarette products that have flavors. And even for Vuse, the same company that authorized some products, it has issued marketing denial orders for the Vuse products that are flavored, saying that Vuse couldn't prove that those flavors are any better for public health, for smoking cessation, than the tobacco flavored version. And then they said, in doing their balancing act for public health, they said, so without that product specific evidence that the flavored things are better, that's outweighed by the evidence that flavored products are more attractive to teens. And so that's one of the key trade-offs here that people are always worried about, and so again, that's where the FDA didn't think the evidence about flavors for smoking cessation. I don't think they weighed in on the evidence about nicotine levels. But I should mention too, though, about all these different technologies. Again, some of this stuff is going way over your head, and you probably, or under your head. I don't know what the right thing is. You don't really need to know all these details about e-cigarettes necessarily. But if you've heard about Juuls, the Juul product that really took off among youth, Juul moved from something in the way they have their e-liquid, that they have nicotine salts rather than this other form of nicotine. And the nicotine salts are more easily absorbed into the bloodstream. So Juul delivers more nicotine than other e-cigarettes. And so according to some studies I've seen, that makes them more effective for smoking cessation, but also seems to have made them more attractive to youth. The FDA hasn't weighed in on that yet, but there are these various differences. The IQOS product is barely making a dent in the US market. They haven't really tried very much they've introduced it sort of in a few places. It's really taken off in some other countries, especially Japan, where basically Japan doesn't makes it hard to sell e-cigarettes, but makes it easy to sell IQOS, and they've gotten a substantial share of the market. So there are always technologies. In Sweden, the snus is dominates the tobacco market in Sweden. And there are far more Swedish snus users than Swedish smokers. So there's it's a much more complicated market than it was 10 or 20 years ago. So on that key background fact, I just also entered, sort of fairly recently, there's a review article submitted to the American Journal, or published by the American Journal of Public Health, written by 15 past presidents of the Society of Nicotine and Tobacco Research, that discuss the debate that's going on in more detail. But they say that this group of 15 believe that vaping can benefit public health, giving substantial evidence supporting the potential for vaping to reduce smoking's toll.
Don, can I ask
we don't know. Sorry.
Don, can I ask a question?
Sure.
And if this doesn't fit in right now, if you can answer this later on or some other time, we could just email back and forth, that's fine. There was an NBE art article several years ago, maybe last year, the year before, and I'm not sure that you were an author of it. I don't think you were. And it was about Minnesota, the state of Minnesota, I think it was, that didn't believe that vaping was a good thing. So they taxed it because it's a substitute for regular smoking. And they found out as a result, regular smoking went up. So will you come to policy suggestions about how to handle things like that?
Yeah, I'll talk about that in a slide or two.
Okay, great, thank you.
Yeah, and I should mention too, by the way, folks, that I have that university, even though I've been at Cornell for a long time, I have that University of Chicago background that sort of expects a lot of interaction at the seminar. It's a little bit harder with Zoom. I tend to overlook chat comments. So if you're making a comment to me, I think it's best for you to speak up, just like Debbie did. And so I know it's a little more awkward than also it'd be hard for me to see all the little screens. So, I'm not going to see your little blue hand or your hand raised if you raise your Zoom hand. So I think it's best just to interrupt. So feel free to interrupt. Okay. The other thing I wanted to say is a sort of precursor, and this is a little bit of almost a defensive slide about the focus of this research, but it is a contribution that we made, is that most vaping is driven really by adult, current, or former smokers. And this was something I could not find anywhere. So we had to go and put this together. But we looked at the National Health Interview Survey to figure out adult smokers and the National Youth Tobacco Survey to figure out about adult vapors, and the National Youth Tobacco Use Survey to look at teen vapors. One thing we ran into there was that in the National Youth Tobacco Survey, 17 and 18-year-old high school students report about 3 times more vaping than 18-year-olds do in the National Health Interview Survey. And I don't know what's going on there. And I've mentioned this in several presentations, that if anybody has great ideas to explain a tripling, we think it's some kind of combination of, well, what we do here is we assume that vaping was underreported by young adults in the NHIS data. And we come up with these, maybe I'll go to the next table. This table shows the breakdown that, but I'm having trouble seeing it with the way your guys' pictures show up. So, it's really that bottom line there. 19% of all vaping days are accounted for by people under 18, and the others 71% are accounted for people over the age of 18. Or another way you can cut it is by how many people are current smokers or former smokers versus never smokers. And you see that, something like 73% of all vaping days are due to current smokers or former smokers. and 27% by never smokers. That number's grown a lot, by the way. It used to be almost everything seemed to be driven by, almost all vaping seemed to be driven by current or former smokers. Now there's a bigger chunk of people that have never smoked but are using vaping. But all of this is to motivate the fact that most of the current research we're going to talk about today is about adults, not youth. And so this is why. It also helps motivate later on why we're going to be talking about smoking cessation. Okay, so those are some background facts just to sort of set the stage. Now let me start talking about this paper. So what we're going to talk about is what the CDC called e-cigarette or vaping associated lung injury, EVALI. And they recognized that cases of this in August 2019. It peaks in September 2019 with about 3,000 hospitalizations and 68 confirmed deaths. So this was a big lung injury thing that seemed to be going on in 2019. Now, 6 months later, COVID comes, and this seems like a kind of a trivial lung problem, but it was a big deal. I mean, one of the things very different than COVID or any other lung disease, basically almost, is that it really was hitting young people. The median age of the hospitalized patient was 24 years old. And there were various reports of hospitalizations and even deaths of people in their teens. So the CDC issued a series of warnings against vaping e-cigarettes because that was the first risk factor they identified as being associated with it. The people that were being hospitalized and dying seemed to have been vaping e-cigarettes. Upon further study, well, yeah, I guess I should say now. Upon further study, they figured out that it was actually never the commercial nicotine e-cigarettes that were causing EVALI, that it was these e-cigarettes that are vaping devices that contain THC, the active ingredient, psychoactive ingredient of marijuana, cannabis, and vitamin E acetate, which was sort of added into the oil that was being used in these THC vaping products. And though that seemed to be what was hurting people's lungs, or actually the CDC determines by about December of 2019, that it sends out a very clear message that it's the vitamin E, it's the THC products that are associated with this lung injury, though they still call it EVALI, which is potentially confusing because it makes it sound like it's coming from e-cigarettes. And this got a lot of coverage in the media and in the internet. I mentioned some articles in the Wall Street Journal, New York Times, CNBC, NBC. There's the peak in hospital admissions. You can see in mid-September. We also did one of these, looked at Google searches, and we see the same kind of peak about the same time when people start looking for words, did Google searches that included things like vaping death and vaping illness. So it's a real, it looks like a real event study here. So to preview the main results, which, in case I run out of time, which often happens to me, what do we do? Well, we're using multiple.
Dr. Kinkle, sorry, I have a quick question about the previous slide. Previous 2 slides ago. Isn't that around the time as well as there was a whole kerfuffle about, I believe it was embalming fluid was figured out to be one of the active ingredients in vaping products? Was that relevant to anything? I don't remember which part of the embalming process it was referring to off the top of my head, but I remember that was a big concern at the time.
I don't, if there was an event around that time, I'm not aware of it. There was an earlier research that came out. I'm not sure if this is the same thing or not, because I'm not really sure what's an embalming fluid. There was a discussion about formaldehyde in e-cigarettes.
That's it.
And there was, what was going on there was certain types of, again, these technologies have been changing. Before Juul, some e-cigarettes made it possible to sort of turn up the current, the electricity on them, and heat things higher. And if you did that, the vapor would have more formaldehyde. Now there are sort of two things that were kind of, there was a wonderful analogy that somebody wrote about this. To get a whole lot of formaldehyde, the study that said, here's how much formaldehyde, when you looked at what they did in the lab to get formaldehyde from this e-cigarette, they had this thing cranked up all the time. And this researcher was saying, look, nobody vapes like that. This is unpleasant, actually. People sometimes will turn it up to sort of get an initial hit, but then turn it back down. And then what the amusing analogy was with a toaster. He said, look, my toaster and every toaster I've ever owned, for some reason has a setting that will burn my toast to a crisp. Now, I don't eat that toast. If I did, that toast would have carcinogens because it would be have all that charcoal on it. But that doesn't say that toasters shouldn't be used. And so there was a big argument about the relevance of this formaldehyde. I think that was all earlier than the vaping. The other thing is that it's not at all. Juul doesn't. That can't happen with Juul. Juul doesn't have the adjustable electricity rate. So, but there was, I should say that in September 2019, or about the same time, new data came out from the National Youth Tobacco Survey showing that teen vaping was at an all-time high. So there was a lot of discussion of that new data. At the same time, there was discussion of the EVALI crisis. And Joe mentioned that I was at the White House at the time, or the Council of Economic Advisors across from the White House. And actually, I went to a series of meetings over in the West Wing where the people from the Department of Health and Human Services and the FDA were talking about what vaping policies should be done. And I'll talk about what policies came out of all that in a little bit. But there was a lot of other stuff going on. Well, that was the other main thing, was this new data coming on. And we'll come back to that and talking about how to isolate this as the cause of the information shock that we think has happened. That's a very good question. Okay.
Thank you for clarifying.
Yeah, my problem here is I can clarify in much more detail than probably anybody wants in some of these issues. And so I've got to keep myself disciplined here. Okay, so back to the preview of the main results. So we launched a bunch of online surveys as soon as we heard about EVALI, essentially. So we started in September of 2019, and we'll talk more about those. We have some aggregate time series data on e-cigarette and cigarette sales, and we have an in-depth cross-sectional survey that we conducted a few months after, about 6 months after the end of EVALI. And from those multiple sources of data, by sort of triangulating them, we developed 3 empirical findings. We find that EVALI was associated with a large and persistent change in perceptions of the relative harm of e-cigarettes. I should add that it does fade off after a year or two. The information shock seems to. We find that EVALI was associated with a big drop in e-cigarette sales. And then in cross-sectional data, we find that e-cigarette demand is strongly associated with consumer perceptions of the relative harm of e-cigarettes. So from those 3 findings, we conclude that EVALI was an information shock that changed the demand for e-cigarettes through changing people's perceptions of the relative harm of e-cigarettes.
Don, are you going to talk about sort of what this information shock did to people's perception of risk relative to something closer to the scientific reality about the harm? I know Kip Viscusi had the piece about what that seemed to suggest that people overestimated the adverse health risks associated with e-cigarette use. I'm just interested in what sort of the baseline from which information shock is moving people. The baseline, well, Kip's evidence probably is best on the baseline. I have some evidence of what happened after the base, in our in-depth cross-sectional survey. So, and that's when I'll talk about how it compares to what the experts think maybe is the reality. So, if you don't mind, I'll put your question off till then. Okay. Okay. So, in terms of our research design, I'm kind of assuming almost everybody has heard, but just in case, the old joke about seeing the drunk
looking for his keys under the lamppost. And after, somebody else tries to help them and help him find them, he said, well, is this where you lost them? And the drunk said, no, I'm just looking here because the light's better. That I want to resist the temptation. And this is kind of I'm on a soapbox here about letting your research design drive your question. Here we have a research question that we can't use some of the clean identification strategies that have become so popular and that have won the Nobel Prize for Card and Angerson and Imbens. But we still think we can make causal inference. Our analysis of changes in perceived harm in retail sales, these are basically the before and after time series. We do this on before and after data, time series analysis. We think the eValley itself was an exogenous shock. It was basically created by these illegal manufacturers of THC products, but we don't have any control group, so we can't use something like a standard diff and diff or an incremental variable or a regression discontinuity or anything. So we try to corroborate these results by looking at the tight timing. We try to bound the impact to some of the other events. And we also think that by the triangulating with the cross-sectional evidence that links eValley to harm perceptions, not the cross-sectional evidence about harm perceptions in vaping, but you'll see what I mean in a couple of slides. And then the cross-sectional demand models, we've got a classically potentially endogenous explanatory variable, consumer perceived harm, and we don't have an IV for it. And I just want to be very clear about that up front. To corroborate the estimate, we do something that is sort of echoes like this. It's sort of analogous to the two-stage least squares. We use the first stage of our time series estimate of the impact of eValley on perceived harm to rescale the reduced form, what you can think of as a reduced form time series estimate of the impact of eValley on retail sales. And that way we have another estimate of the effects of consumer perceived harm on vaping demand, and it helps corroborate these estimates. So that, again, I want to be very upfront about these limitations to this design, but also fairly aggressive, I guess, in trying to say, I really think that you can make causal inference even though we don't have a D&D or et cetera. So to preview the conclusions, we conclude that it looks like eValley created information shock that reduced e-cigarette demand substantially. It also seems to have reduced smoking cessation. So, for a public policy perspective, we predict that the deterred smoking cessation over the next 50 years will generate 450,000 life years lost, while the deaths directly to eValley were only 2,000 life years lost. So by scaring people away from e-cigarettes, and smokers in particular away from e-cigarettes, was the big public health impact of this information shock. Now, turning to Debbie's question about policies, there's been a lot of research on the effects of taxation and other policies on e-cigarettes, a growing body. There haven't been that many states that taxed it. That NBER paper that Debbie mentioned was looked at one of the first states that taxed it and found evidence again that taxing e-cigarettes seems to increase smoking. A couple of other studies by Abby Friedman up at Yale and Mike Pesco on Georgia State have found that when there was state variation in the purchase age, that increasing the purchase age of e-cigarettes again seemed to drive teenagers into smoking. Abby found another similar effect like that of a local public policy. I think it was in San Francisco, some policy that banning vaping. I remember somewhere in California. For us, East Coasters, or almost East Coasters, all of California is blurs into one area. So there's been a lot of research on that. Hunt Alcott and his co-author Rafkin have a really nice new paper in the American Journal of Economic Policy, and they develop a behavioral economics model that looks at all the trade-offs that assumes their internalities and externalities, and their average of all these simulations they did is that the optimal e-cigarette tax was $3.73 per milliliter, which would basically be about double the current price of e-cigarettes. And it certainly supports the recent trend towards higher e-cigarette taxes. They find evidence, and unfortunately, I'm not going to get a chance really to talk about that. They used kind of a different approach, a shift share identification approach, and conclude that it doesn't look like e-cigarettes and cigarettes are substitutes or complements. They find them pretty much independent. And so that's that's one of the things that's driving their result that the e-cigarette tax should be high. But they also put in a scenario that say, what if consumers overestimate the harms of e-cigarettes? Instead of a tax of $3.73, it's a large subsidy. The subsidy is actually, they find, kind of implausibly large, and so do I. They find that if people overestimate the harms of e-cigarettes substantially, that people should be being paid $18 to $38 for every e-cigarette they smoke, they vape, and which does seem like kind of implausible. They basically say in a footnote they see this as an illustrative exercise. So below, we're going to find a lot of evidence that consumers do indeed seem to overestimate the harms of e-cigarettes, and that anticipates my answer to Joe's question earlier about that. I'll also mention that I'd like to think about more about this, and if any of you have ideas about this, I think there's been an interesting line of health economics research on shocks like this. Back in the 80s and 90s, Tom Phillipson and Richard Posner did a lot of, and others, Joe Hutz did some work on the AIDS information shocks. Jerome Atta had a nice thing about the mad cow concerns about the mad cow disease. And of course, there's the COVID-19 information shock. And I think it helps make a basic point in health economics that for health-related goods, the monetary price is one thing, but the health price is also can be very important. And actually in the paper, which I'm sorry I couldn't circulate ahead of time, in the paper I make the argument, we go through some numbers that suggest that the health price you pay when you smoke is far larger than the monetary price you pay for that pack of cigarettes. And so, and if people think vaping is as bad as smoking, that means the health price of vaping is more important than the monetary price of vaping. And I think that's an important insight to have, that again, it drives a lot of these things. Okay, so that's all this preview stuff. I've spent very long introductions, but I'll try to keep on moving. I'm going to start off with this time series and cross-sectional evidence on the impact on the consumer perceptions. So here's before eValley, we use data from the National Cancer Institute survey they run not quite every year, called the HINTS, Health Information National Trend Survey. We use the same question they ask about e-cigarettes. We started asking them in online Google surveys questions. We started asking them in September 2019, and we've kept on running them. We ran the last one a month or two ago. And the survey question was, compared to smoking cigarettes, would you say that electronic cigarettes are much less harmful, just as harmful, more, or much more? And we published some of the early results of this in the Journal of Risk and Uncertainty, but here's the latest version of the graph. The HINTS data up to 2019 fall along that line, shows the trend line, that even from 2012 to 2019, more and more people were saying that e-cigarettes were more harmful than, they're more harmful than regular cigarettes. But in September of 2019, when we started doing it, those are all those clear dot, kind of brownish dots. We see a big jump of about 16 percentage points higher. If you look at the 2020 HINTS survey, it's up there in that kind of, it looked like maroon on my, it's like a 17% point jump. So it's almost doubling the fraction of people that think e-cigarettes are more harmful.
Excuse me, Don. could it be that COVID had something to do with the change in perception? Because, we do know that COVID has been causing a lot of mental stress, and we do know that people smoke more, whether a vape or regular, when they are under mental stress.
Right. That's a really good point. Because of the scale of this, because we went back to 2012, it's kind of hard to see. The first big cluster of those points are all before COVID. So that was one of the benefits of the fact that we got into the field in September of 2019 and continued through and past COVID. And basically, somewhat surprisingly, it doesn't seem like in the Google surveys that we ran, you basically see it's pretty high up through COVID and in a little bit after COVID, then it starts drifting on down back to trend line. And so somewhat surprisingly, it doesn't seem like COVID contributed to this, which we wouldn't have known if we hadn't done those online surveys before COVID. So it was very fortunate in many ways that we got that stuff out into the field.
I have one question. So do the e-cigarette companies, are they allowed to advertise, and do they do any information advertising comparing their product to cigarettes? And I think maybe getting more towards the eventual estimates, did their advertising change in response to these health incidents?
That's a great question. I'm writing it down, the last part of it. I know the answers to the first couple parts, and then the last part's a really interesting is a question I don't know the answer to. So what I do know is, yes, e-cigarette companies have been allowed to advertise, basically because the FDA regulation of them has been phasing in. And so during that time period, they've been allowed to advertise like any other consumer product. So they've been advertising in magazines, even on TV. I've published a paper with others, Deval Dave and et al. I'm part of the et al. In the Journal of Health Economics about TV advertising effects. But so yes, they're allowed to advertise, but no, they're not allowed to make any health claims because they weren't an approved product through the FDA. Sort of the reason they were allowed to advertise is they said, hey, we're just a consumer product. We're not saying anything about health. We're not saying anything about cessation. So they could not advertise and say we're safer than cigarettes. So I don't know if they made any changes. So the part I don't know about the question I don't know that you ask is I don't know if they made any changes at that point in time. I don't know of any. And I can't really see that they would have, but they might have changed. They might have actually just, I don't know. I will stop. Full stop. I don't know the answer whether they changed their advertising. But they weren't making any health claims even before EVALI. Okay, so this is the time series evidence that it looks like there is a shock to people's perceptions of the harmfulness of e-cigarettes. Now, we also conducted this in-depth survey. I'll tell you more about the details of it, but for right now, I'll just kind of jump to its results. In May of 2020, we conducted a survey, a custom survey. And in that survey, about 30% of respondents agreed that vaping is much more harmful than smoking. They also had a lot of other misinformation. A really common piece of misinformation that is, long predates EVALI is that a lot of people think that nicotine is the substance in cigarette smoke that causes cancer. So about over half, slightly over half thought that. So another way of saying it, only slightly less than half realized that that's not true. Nicotine does not cause cancer. Nicotine is what gets you addicted, but it doesn't cause cancer. It doesn't cause emphysema, chronic obstructive pulmonary disease, or any of the other major causes of death associated with smoking. In this custom survey, only 15% had heard that the EVALI cases were mainly linked to THC vaping products, even though this was now 5 or 6 months after the CDC had authoritatively said that was the case. 19% had heard the incorrect statement that was linked to flavored products. And I think this has to do some with the a lot of discussions about flavors and youth vaping that was going on about the same time in the press and in policy circles, as EVALI was, but there's no evidence that flavors had anything to do in the nicotine products. And some of them had again heard the incorrect statement that they're linked to the use of all vaping products, not just flavored products. Now, an interesting 17% of people said we didn't ask about EVALI, by the way. The question asked, over the past 6 months or so, have you heard about anything about lung injuries associated with vaping? And 17% said they hadn't heard anything. And that kind of creates another quasi-experiment to sort of corroborate this information shock. Those data points are actually there in this figure here. The green rectangle are the respondents to our kind of dark green rectangle are the respondents to our survey in 2020 that said they had heard about EVALI, and the red triangle right below that are the respondents to the same survey that said they hadn't heard about it. So you see that people who have not heard about EVALI are closer to the trend line of people, what was going on before EVALI ever heard. So sort of this clueless group gives us kind of another test of this. Here's the more detailed breakdown of that. And again, it's the looking down at the much more harmful and much more harmful. Those proportions are much higher among the people that said they'd heard something about vaping and lung injuries compared to the people that hadn't. Not surprisingly, the don't knows get really high for the people that have, these are kind of people apparently that aren't paying much attention to, they haven't heard anything about lung injuries, and they're not willing to say that they know anything about the relative risk of vaping and versus smoking. This is getting closer to Joe's question about how life expectancy is something that we can compare to experts. This shows how, in addition to the question about the perceived harm of e-cigarettes, we also asked questions that allowed us to calculate each person's perception of the life expectancy loss due to vaping and smoking. And one of the take-homes here is that people think e-cigarettes are relatively more harmful than cigarettes because they think e-cigarettes are absolutely more harmful, not because they think cigarettes are less harmful. You see what I mean? It could, when you say e-cigarettes are more harmful, it could be that they think cigarettes are safe, but they don't. They actually think cigarettes are about, cause about 10.7 years. The people that perceive e-cigarettes as much more harmful, they see e-cigarettes as causing twice that amount of life expectancy loss. So 10 years is about the right number for the life expectancy loss due to smoking by conventional public health estimates. Michael Darden was my discussant at this recent HERO session at the AEA meetings. And he's done some really nice work with Donna Gillespie and others, published in the International Economic Review, I think, that does a econometric estimate of the life expectancy loss and says 10 years is actually too much. Smoking probably is not as bad as that, but I don't think there's any real reason to think that the average respondent in our survey is reading the International Economic Review. So I think the fact that they're agreeing with the public health experts on smoking is a good sign, but they're way overestimating the risk of vaping. And I think I drive that home in another page or two, a little bit more. Well, let me just go ahead and answer Joe's question now. The public health English authorities argue that vaping is 95% safer, or 5% the life risk. And this is one of the numbers that Alcott et al. Use. So at 5% of 10 years, it should have been a half a year of life expectancy loss. And so even the people that think e-cigarettes are much less harmful are still way overestimating the risk of e-cigarettes. And Kip Viscusi found something similar, though maybe not quite this magnitude. Alcott et al. Did their own survey of experts in their survey of experts, the median expert answered that they thought that 37%, that vaping had 37% of the life expectancy loss due to smoking. So again, given 10 years, that'd be about 3.7 years. So even with that much higher estimate that Alcott et al. Found in their survey, even again, the people that perceive e-cigarettes as much less harmful are overestimating the risk of e-cigarettes. So here, everybody's, if we take that, even that 3.7-year loss is the right number, even the much less harmful people are on average overestimating it. And some people are, the people in the much more harmful category are overestimating it by a factor of 7.
So I mean, yeah, isolating the effect of this information shock, but just sort of in general, is this sort of like as a result of some of the success of the recent tobacco control, efforts, and have that you have those on the tobacco control side sort of pushing hard at rising rates of e-cigarettes and have successfully focused their energies there and scared the hell out of everyone. I'm just trying to get a sense. I mean, especially the rates that are so much higher than cigarettes. I mean, given that the proportion of both adults and youths who are smoking regular cigarettes is so historically low that just the messaging is much more intense now for vaping.
Yeah, I mean, I think so. I mean, I think there are a couple of things. I mean, there's been some intense messaging. There, the CDC has been running the FDA, I'm sorry, has been running a campaign about, they changed their youth tobacco campaign to be a youth vaping prevention campaign. Other groups like there's several other, the Truth Initiative, Bloomberg launched one only recently, so they couldn't have affected these, but at least after they launched in the fall of 2020. But I think there has been a very intense focus of publicity from these a lot of anti-smoking groups turned into anti-vaping groups. And Mike Pesco suggested something too, and has some evidence about this, and it might be on one of the papers that's joint with you, Joe, that youth perceptions of the harm of vaping seem to be partly associated with the tax rates they face and policies they face.
Yeah, that's right. That's right.
And I think that's generally, I think to some extent, when you start passing law, when you start passing laws and passing and taxing things, the public says, well, there must be something wrong here, and infers from that vaping is very bad, and maybe again even worse than, apparently they believe it's worse than smoking. Can you remind me when does this seminar end?
45. So
okay, so I do need to pick up my pace here. I do really want, I don't want to discourage questions, but I want to be sure I get to at least some more things before I do this. So let me kind of just run through a couple more slides really quick. The next thing we do for this, to keep on saying that the logic here is that in May of 2020, we're looking at what determines your perceptions about harm and life expectancy. And so we run this linear probability model that you perceive e-cigarettes as much more harmful, or we use an LLS model of life years lost due to vaping. And then we see what you said about what statements you had heard, where the excluded group is that you hadn't heard anything. And the fact that these dependent variables are associated with what you've heard links it saying, okay, so it really is true that it seems like having heard things about a valley and having heard specific things about a valley is contributing to why you think e-cigarettes are more harmful or much more harmful than smoking. And so here you can see that, knowing the correct fact that there are some hospitalized cases has an effect, but knowing the incorrect fact that it was linked to fruit has sort of the similar, at least on the probability. Knowing the correct fact that it was only linked to THC actually reduces some of your predictions. And so, just being a general skeptic that the results are exaggerated also reduces. Not surprisingly there, but all these things, support the idea that people are thinking that the shock that happened back in September of 2019 is still causing people to have variation in their e-cigarette perceptions in 2020, in May 2020, when we surveyed them. The last column of this paper, of this table, directly looks at Kip Viscusi's Bayesian learning model and adds, so Kip suggests that when people think about how risky vaping is, they start with the prior, that it has the same life expectancy loss during smoking. And so that does explain a lot, it has a very strong, significant effect. And so for every 1 year of increase in life expectancy loss due to smoking, you think vaping has 0.7 life expectancy loss, but then all these other things, plus socioeconomic status variables, increase your numbers. So these, again, are very similar to what Kip finds and supports his Bayesian learning model. And this could be a lot. We sort of put together, some of the most important right-hand side variables and said, look, if you were somebody who had a graduate degree and heard these correct statements, and the skeptical statement, you'd expect 7.9 fewer life expectancy loss than somebody who with less than high school education and who hadn't heard about a valley. And if your prior belief was correct about the life years due to smoking, you'd predict that the life expectancy loss was 6.4 years. So it's a substantial impact, but note that even this group is overestimating the life expectancy loss that I just run through in the previous answer to Joe's question. Okay, next one, I'm gonna have to start flying even faster. Time series and cross-sectional evidence on the impact of the valley on demand for e-cigarettes. Here we're using the Nielsen IQ retail scanner data. The participating retailers provide Nielsen just with their scanner data, and they've got a big chunk of a lot of outlets that sell e-cigarettes, but they don't cover vape shops. We actually have some vape shop data, but it's kind of not ready for prime time, but it doesn't seem to show anything different than we're finding here. We estimate these interrupted time series analysis models, ITSA models, of the impact of the valley. And what we do is we allow the shock to change the level and the growth rate over time. And these are just easily seen in the graphs. What we end up doing is doing a 2-event ITSA model to look at the effect of the valley and COVID-19 on e-cigarette sales. And there's the graph that shows the result. That we estimate that e-valley is the first vertical dotted line, and there is a big drop down in e-cigarettes immediately. And then you can see that the e-cigarette sales that had previously been trending upwards changed to a negative trend from mid-September to mid-March. About the time COVID hits, e-cigarettes sales jump up and then flatten out and slowly trail off. So what we do is we predict out where e-cigarette sales would have been without a valley is 122 million. Compare that to what we predict with the valley of 74 million, and estimate that the valley caused a 39% drop in e-cig sales. The big threat to this research design, of course, is other events that happened. And we think that the tight timing that helps do that, and we also try to rule out some of these other events. And let me just tell you some of those stories. This picture has too many vertical lines. Sorry about that. So I put in a red arrow for that's the valley line. This one just confirms that it wasn't like the e-cigarette manufacturers changed price during the valley. The unit price seemed pretty constant with no particular change. Maybe bumped up, but you see there's a little bit of noise all around. What the e-cigarette prices are doing during COVID is more complicated, and is something we'll want to look at down the road. I'd refer to the regulatory developments as the sound and the fury. For those of you who remember your Shakespeare, remember that it's a tale told by an idiot, full of sound and fury and signifying nothing. And that's sort of what, I don't want to identify who I think the idiot is, but the regulations don't seem to have signified nothing. The Center for Tobacco Products started trying to do things. Partly, they were behind what the market leader Juul had already done. Juul had already voluntarily withdrew its fruit flavors back in 2018, and then it withdrew its mint flavors in 2019. After that, FDA sort of basically banned flavored Juul products, but Juul was already gone, but the other pod-based e-cigarettes that use these nicotine salts were sort of effectively banned as of about February 2020. There were some states that announced, but fewer enacted emergency bans in the fall of 2019 on flavors. The other big policy was that in December 20th, 2019, President Trump signs the what's known as T21 that raises the tobacco purchase legal age nationally to 21 years. And that happened more or less overnight. And that included e-cigarettes. And it's these, the FDA compliance policy and the T21 policy that were sort of being discussed in the West Wing meetings that I went to. And I probably shouldn't say anything more about those meetings, but they were fun to attend. Interesting to see how policies are really made. To look at this, one of the things we did was extend our ITSA model to look at 6 events, to have all these different things that happened in them. And then we also broke down our models by flavors. And basically on the 6 event model, we don't really find much of anything. There it is, you can see it changes intercepts and trend lines little bit by little bit when you put those things in, but it doesn't essentially change the picture. We're looking at the dotted lines, all the predictions from the model. More interestingly, but almost impossible to read, is this one that shows flavors. But what's happening there is the first one, for example, is when Juul withdrew its flavors. And you can see there's a big drop in flavored cigarettes because Juul had a big market share of all flavored cigarettes. The next line is when Juul withdraws its mint flavored cigarettes. And again, I'm sorry, the next line is EVALI. The third vertical line is Juul withdrawing its mint flavored e-cigarettes. For a week or so, sales went up. And I think that was people running to the stores buying the last stuff on the shelf. But after that, mint sales drop on down. But what happens in each case is when flavored e-cigarettes went down, mint sales went up. When mint sales were banned, menthol went up. And so basically we're seeing lots of substitution across flavors, that when one flavor is banned, people switch into the non-banned flavors. And so that's why we think that all the flavor bans didn't signify much. We're more worried about T21. I'll just say, look, we tried to sort of think this one through and try to say, well, look, what if all of the decline after December 20th was due to T21? And what if without T21, it would have resumed its pre-EVALI growth? That would say then that T21 decreased e-cigarette sales by 17%. And so EVALI only decreased cigarette sales by 22% instead of the 39%. And we think that's reasonable. The one thing we can't bound out is what happened, what COVID did. As I said, sales are flat after COVID. Is that because of the lingering effects of EVALI, or is that the effect of COVID? We don't know. We attribute it to COVID because we want to be conservative. Okay. My picking up the speed is working, and thank you for keeping your questions till later so I can get through it all. Here are now our cross-sectional models of e-cigarette demand. Now I'm going to describe we already talked a little bit about this Nielsen custom survey before. We got them to survey a subset of their home scan consumer panel. The households were screened on having at least one purchase of cigarettes or e-cigarettes ahead of time, so they're all smokers or vapors. We get their self-reported smoking and vaping behavior, and once again, we ask them the same question about e-cigarettes, but we also ask them about absolute harm. We ask them a bunch of other things, including some questions about COVID, which we'll be doing in future research. We'll be using our COVID questions. But right now, I just want to talk about these e-cigarette demand functions. The first column is just sort of unconditional demand, where if you zeros if you don't vape at all, or the vaping days for people that did vape. And you see really large effects for people that think vaping is much less harmful. And then a nice gradient where they turn negative effects if you think vaping is more harmful or much more harmful. The difference between more and much more doesn't seem to be too big. But again, and these are all very large compared to the dependent variable mean. A lot of the action there, especially in the much less harmful, is on the vaping participation, whether you vape at all. Again, about 14 percentage points of our survey vaped at all. And like perceiving that vaping was much more harmful would reduce that, cut that almost in half. Then conditional on vaping at all, you see what happens and how many vaping days you had in the past 30 months. That's the intensive vaping demand. So we want to try to see how this compares to what we estimated in the sales data. So we calculate how the fractions that change in all these perceptions, pre-evaluate, post-evaluate. We use the estimated coefficients on the demand models, and we predict how much vaping goes down. And so we end up predicting that vaping days go down by 24%, which seems to flow partly from some people quitting vaping entirely and also fewer smokers initiating vaping. Now, this is where, as I said before at the outset, there's endogeneity bias here, potentially. And we think there's some exogenous sources in this variable that we're using to identify the effects of perceptions on vaping demand. We also think there's a lot of potential endogeneity. Now, one thing is our cross-sectional model gets an answer that's kind of right there in the middle or towards the low end of what we got in our time series analysis. Another thing we can do, and it gets a little bit complicated, so I'm just going to sort of zoom on by it, but sort of analogous to a two-sample, two-stage least squares, we can rescale one of our time series estimates with the other time series estimate to get something that is essentially the coefficient on perceived harm in a vaping demand question, in a vaping demand function. And in doing that, again, we find that the time series estimate is bigger than the cross-sectional evidence. And so if we're worried that the cross-sectional estimate is biased away from zero, we're not getting any evidence of that when we compare it to the time series estimate. So this is how we feel like we're triangulating in on this. I think I have just enough time to kind of get to the real punchlines of the paper finally, or at least for the public health impacts. We do the same kind of stuff with the cigarette market. Just note here, we don't find anything going on in the cigarette market. We don't think that's really surprising because even if people shift, even if vapors shifted back to smoking, they'd be a small fraction of the cigarette market. And there's a lot of other things going on with the cigarette market, including seasonality, that we tried to deseasonalize this, as you can see. But if we did that a little bit wrong, we could have easily swamped any real effect of the valley. You do see something interesting with COVID, and that is, and this is a subject of our future research, a big spike in COVID. The same time the rest of us ran out to stores and bought toilet paper and sanitizer, smokers went out to stores and bought cigarettes and cartons of cigarettes. And so that's going to be a big source of our research, our future.
And had you also found that spike for the e-cigarettes?
Yeah, we did actually. If you go back, I'm not
Both
going
of them.
back, but we did find a smaller spike. We haven't really focused in on that either. But yeah, during the next phase of this research is really going to be what happened during COVID. So right now we sort of stop at COVID. A great question. We estimate that smoking, that EVALI discouraged smoking cessation. We then use this, so we extrapolate that and we predict that means that there were 150,000 fewer quits with e-cigarettes in 1 year. We then use this population health simulation model, sort of a Markov model of people making transitions from one state to the other. And we end up with a prediction that that I gave earlier on, that 450,000 life years lost will be due to the fact that EVALI scared smokers away from quitting smoking and kept them smoking, or actually we assume that they switched to less effective ways of quitting, and that's why they still tried to quit, but they weren't as successful as quitting because they didn't use e-cigarettes, is what our simulation model assumes. Here's some pictures of our simulation model. We don't really have time to go through. The last slide, so I did actually get through all my slides. I'm amazed with myself. According to my watch, I have a minute left. One question is, well, is there a direct policy implication here? And we actually think, yes, there is, that the CDC could have handled this information shock better. And in particular, not just saying, oh, ideally they would have known right away. What if they'd just done what Public Health England did? Right at the same time, the CDC was telling people, you really should avoid all e-cigarettes. Public Health England was saying, our advice on e-cigarettes remained unchanged. Vaping isn't completely risk-free, but it is far less harmful than smoking tobacco. And they were saying, it's, citing the CDC's evidence that the CDC sort of refused to emphasize, that it was seen to be linked to illegally produced THC products. So if we use our same kind of model, if US perceptions had changed only as much as UK, then vaping would have fallen by 15% instead of 24%. So there were a lot of that discouraged cessation could have been prevented if we had done as well as the UK. And that's pretty conservative estimate of doing as well as UK, because the US shocked the UK. And the UK was partly health authorities were partly trying to offset that. If the US had also from the get-go had been saying things like the UK was, then even the perceptions in the UK might not have been shocked as much. So we think that there actually is a policy relevance here, that they kind of dropped the ball on this, and they could have done a better job of not scaring people and basically that Public Health England is kind of like my broader conclusion that I'll stop with, and take any advice, any questions if people have any time to stay on, is that as an information problem, this doesn't seem like a really difficult message to send out. E-cigarette vaping isn't completely risk-free, but it's far less harmful than smoking tobacco. And I think they also make statements that it can help you to quit smoking. And so, again, this sort of doesn't seem like rocket science to be promoting that piece of information, and we think that would promote public health. And that's where I'll stop.
Thanks so much, John. Are there final questions, comments?
Yeah, I'd like to know if you also did some separate demand estimations for different groups of people, like men and women, different age groups. Was there a differential impact of the EVALI for different groups, other than divided by how harmful they thought this was?
We haven't done enough, I guess I'll say that. We haven't explored that in any great detail. The models I presented did have all those kinds of variables as additional explanatory variables. So it controlled for those differences, but didn't look. But I think you're talking about interactions. So we controlled for the fact of whether of your schooling, but we've looked at some of those interactions to see if people with schooling had more or less effects, but we haven't. We probably could do more than that. That's a really good idea.
Thank you.
Other comments, questions? It reminds me, Don, it strikes me, is it people sort of worried that without just a clear, consistent message about harm, that youths are going to sort of take up e-cigarette? It reminds me of the argument about, why you can't dilute an abstinence only message on sex education by talking about any kind of harm reduction, because it's going to have these unintended consequences of inducing. But what's your
Yeah, it does feel like there's something like that. It's funny that you mentioned abstinence only, because that's one has really puzzled me about the way the public health community has divided over harm reduction, tobacco harm reduction. That in other areas in public health, the concept of harm reduction is accepted an idea, and abstinence only usually isn't, AIDS is the prominent, probably the most prominent example of harm reduction. Yes, it'd be better if people abstained from IV drug use, but having needle exchanges and giving them clean needles reduces the harm from their IV drug use. So knowing that we can't achieve abstinence only, we can still achieve harm reduction. But it goes with sex education as well. But then for some reason in tobacco, a lot of people just know it has to, abstinence only. And I guess I overstated a little bit when I say some reason. I will say that, I think I mentioned this to somebody earlier in chatting today, is that, there's that old saying about, fool me once, shame on me, fool me twice, fool me once, shame on you, fool me twice, shame on me. That in the past, the tobacco industry has shamelessly lied about reduced harm products back in the 80s and 90s. And so the people are incredibly skeptical about the tobacco industry's claims that they've got a reduced harm product this time. This time, I think they're right. There's lots of evidence not coming from the tobacco industry that vaping, and not coming from the vaping industry either, but coming from independent scientists, that vaping is less harmful, but there's still that underlying skepticism. I mean, there is one incredible irony about the FDA regulatory process, and that is that this group that hates the tobacco industry so far has issued marketing denial orders for all sorts of vaping products produced by independent vaping companies. And the only e-cigarette left standing right now, legally marketed, is made by RJ Reynolds Tobacco Company. So, which is actually part of British American Tobacco. Anyway, but so it's, the FDA regulatory process right now has created monopoly, it's creating market power for tobacco companies to sell e-cigarettes. And it's kind of a perplexing, if you don't trust if you don't trust the tobacco company, it's hard to understand why that outcome happened.
Thank you so much. Thank you everyone for coming. Thank you, Don, so much. A great talk. I still miss the applause at the end of a talk. Next week, we have Derek Rury joining us from the University of Chicago. We'll present some work on education policy. So I look forward to seeing you at the talk next week. Don, you want to just hang on for a second?
Yeah, sure. Thanks so much, everybody. I really enjoyed it.
Thanks.